Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 4, 2025. This video is on a JAMA article, Original Investigation, published on October 29, 2025, titled Personalized Hemodynamic Resuscitation Targeting Capillary Refill Time in Early Septic Shock, the Andromeda Shock 2 Randomized Clinical Trial. There's an accompanying editorial titled Capillary Refill Time in Sepsis, Searching for the Holy Grail. Septic shock lacks personalized resuscitation strategies. The objective of the study was to compare capillary refill time personalized hemodynamic resuscitation, CRT-PHR, versus usual care to the randomized clinical trial across 86 ICUs in 19 countries. Cohort comprised of 1,467 adults within 4 hours of septic shock onset. Intervention: capillary refill time personalized hemodynamic resuscitation with pulse pressure, diastolic arterial pressure, fluid responsiveness test, and bedside echocardiography. Control: standard septic shock management per guidelines. Outcome: hierarchical composite, 28-day mortality, vital support duration, and hospital stay. Study protocol: mean age 66 years, 43% were female, Apache 2 score of around 19. The CRT-PHR tailored algorithm over 6 hours. CRT was normalized in 85.9% versus 61.7% in the usual care group. Statistics was win ratio, intention to treat analysis, the primary endpoint analysis by the win ratio method. What did they find? Primary win ratio is 1.16, P equals 0.04. 28-day mortality was 26.5% versus 26.6%, non-significant. Vital support free days 16.5 versus 15.4. Proportional odds ratio 1.28. Fluids: minus 251 mils less fluid versus usual care. Lactate lower at 6 hours, less than minus 0.3 millimoles per liter. Limitations: open label, practice variation, algorithm training was required. Key takeaways: capillary refill time guided personalization accelerates recovery, reduces organ support duration without increasing mortality, supports perfusion targeted shock resuscitation beyond lactate alone, potential to change septic shock resuscitation standards. The accompanying editorial discusses the study, and the key takeaway from the editorial was the CRT guided bedside strategy improves recovery dynamics versus usual care. Clinical pearls: use capillary refill time bedside as dynamic perfusion marker. Assess pulse pressure and diastolic pressure before fluids. Prioritize fluid responsiveness testing to avoid overload. Mean arterial pressure, echo, and dobutamine test, personalized perfusion support. Lactate reduction is secondary to tissue perfusion signals. Eponyms: hit pause and read this at your own leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.